Good afternoon, everybody. It's a great honor to be here, and it's a great honor to start this session on Agentic AI in healthcare. And yeah, as you say, I have several roles. I'm a behavioral economist, so it's kind of interesting at a health conference to have somebody open that hasn't got a formal clinical background. Having said that, my background spans 15 years of the honor serving in the National Health Service in England, and it's been a great pleasure to join you here today. As part of my role at Durham and in the NHS, I've been working a lot on clinical innovation with clinicians like yourself, and it's amazing, this wave of AI that we have currently happening. And there's not so much of a single social media post from any organization that doesn't necessarily include AI. So it's so omnipresent, shall we say. So what can we do about this? Well, it's very interesting. We have a real opportunity, There's a lot of the times when I talk with clinicians and we talk about the first time we had a wave of innovation like this, which is when the internet became a thing in the late 90s, where it really took off. And this very much feels like a very, very similar time. We've been working on several projects, and specifically on AI, but specifically Agentic AI. Over the last few years, AI is already showing that it can do quite a lot of verifications with clinicians to improve their hospital flow. And oftentimes, our clinicians are saying in England, we're too busy. We have loads of patient lists to get through, and there's always a waiting list. Now, as a behavioral economist, can you do something about this? Can you find something to help reduce the burden of this ever-increasing waiting list? Now, I know in Pakistan it might be slightly different, and you might have a very efficient system. We don't necessarily in England. There's loads of improvements that we can make, and I think most of the use case is making sure that we can get clinicians more quality time with the patient in front of them. That's where we want to get to. And Agentic AI is almost like a second iteration of this, where you can get clinicians do what we train them to do, which is doing the inferential diagnosis of understanding what is happening to the person in front of them. Healthcare is a uniquely personal experience. We all will need healthcare at one point in our lives. And so making sure that that quality connection is there, if we can use some of the innovative technologies that are available to us on Agentic AI, or specifically AI, but Agentic AI, and I'll come to that in a second, it will mean that the contact time that you have with your patients in front of you will go up in quality, not quantity. We have millions of people waiting in the health service for planned operations. We can reduce some of those waiting lists by optimizing work streams, but also giving the clinician the data and the patient information that is relevant for helping with the diagnosis and cure. And the way we've been doing this, certainly in East Kent, is we've been running several experiments or projects where we make patient systems talk to each other. It sounds strange. We have a national health service in England, and actually what tends to happen if we have one national health service, we have 158 different organizations within that. We employ 1.8 million people in England, and all those systems don't talk to each other. So actually understanding the most relevant clinical data right at the time where you see the patient is extremely crucial. And we found that actually with implementing some of this Agentic AI, where the clinician uses it as an assistant to concatenate some of the most relevant clinical data for the patient in front of them, it speeds up their clinical diagnosis by about 80%. And it's more accurate. So actually, it's really, really, our clinicians are saying, we need to do more of this at scale. We don't want to just do this at small, innovative projects. We want to do this at scale. I want to be able to do this at every single department, so that wherever the patient flows within the hospital, and even more challenging when the patient gets discharged out into the community, back into primary care. All of those systems need to talk to each other. It's very difficult to do this without the help of AI, and specifically the help of generative AI, where you can ask a complex set of databases, give me the most relevant bit of information about this patient that's right in front of me. So that's what we've been doing, and specifically on Agentic AI is where a patient is being seen by a clinician, and the several diagnostic tests that have been done and run in the hospital can get iterations of classifications, so that again it helps with diagnosis with the patient. And all of this is really speeding up our workflow. It's really great because East Kent, I'm not proud to say, is not one of the best performing hospitals in the country, but we have been improving our performance, and part of that is because of these innovation projects. And one of the things that I would like to say, whilst opening this and only having a short amount of time to talk to you lovely people, is that actually even though we can really increase our workflow and we can really reduce patient waiting lists and increase best diagnosis, remember it's not necessarily about efficiency. It's making sure that we use the technology to increase the quality of the interaction between the clinician and the patient that's in front of you. So with that, I would say that would be the main, with that, I would like to finish by saying, let's not get carried away by saying we just want to focus on AI, we just want to focus on technology. Technology is not the solution. Giving people time back, quality time back, face-to-face with clinicians and patients, that will be the better outcome for the people that we serve. So with that, thank you very much.